Okay. Which of the following nerves is most susceptible to injury in this patient's condition? A 35-year-old woman presents to the emergency department after a fall on her outstretched right hand while rollerblading. She complains of severe pain and limited movement in her right shoulder. Physical examination reveals fullness of the anterior shoulder region, and her right arm is held in a slight abduction and external rotation. Which of the following is the most likely susceptible? Nerves is most susceptible to injury in this patient's condition? Okay, so I'm gonna go ahead and get rid of what's it called? Axillary, because she has a fullness of the anterior shoulder region, which classically that would present with like flattening of it. So it's abducted, which means it's close to her body, and it's externally rotated. Or abducted is away from her body and externally rotated. So I imagine that whatever would do the opposite is kind of what the damage is here. So anything that's going to, it's probably gonna be musculocutaneous. Wait, no, no, no. It goes like this. Musculocutaneous is one working. Radial nerve would be. Yeah, actually leaning towards radial nerve now. Externally rotated, yeah. Because if it, I think musculocutaneous nerve is kind of working unsolicited or unopposed. So I don't think that's the answer. Suprascapular is going to deal with like shoulder movement. This I don't think it's going to have anything to do with your ulnar nerve. Is I actually don't know. I think this is the right answer. I don't really have a great reason to get rid of ulnar, but I would say this.
Okay, so let's actually look at this, right? Severe pain, limited move of the right shoulder, fullness of anterior shoulder region, right? So if you think of the anterior shoulder, what region is this?
The anterior shoulder,
Yep. Like give me a muscle that sits there.
the deltoid.
Yeah, deltoid, right? And then all of a sudden held in slight abduction, right? And externally rotated. So anterior shoulder dislocation, right? Because it's popped back and
Oh,
forward,
yeah.
right? So the axillary nerve is the most, right? As it wraps around the cervical neck of the humerus is proximal gluteal joint, which makes sense because the axillary nerve does what? It innervates what?
Say it again. I'm sorry.
What the axillary nerve? What does that
It,
innervate?
it innervates the deltoid.
Yeah, the deltoid, right? So the deltoid, right? You just think of it. The way I think of this nowadays, right? Which is back in the day, you used to memorize everything, right? But nowadays, like you just think of where does that nerve go to, right? Like as in like muscle wise, right?
Mm-hmm.
So I think of it in the reverse now, right? In a sense that when I envision a person, right, and they have a musculoskeletal issue, I think of the muscle first. Oh, what muscle's in that region with the bone? And then you can go, okay, what nerve innervates that? You get what I'm saying? Instead of the reverse, like, oh, what nerves are around there that innervate what? Does it make sense? Because it's a little
Yeah.
easier to think about, right?
Yeah.
So if you know, oh yeah, if I'm breaking the proximal portion of my humerus, and that's where the deltoid is located, right? Which is, most people know where the deltoids are, right? Then you can be like, okay, so if it's the injury is close to the deltoid, okay, now you can take it to the next step. Oh, what innervates the deltoid? That's probably what's injured, right?
Yeah.
So for instance, if you kind of look at the rest of the things like radial nerve, what does your radial nerve do?
The triceps.
Yeah, your triceps, right, which is kind of the back portion, right? And that doesn't, that's not really damage of the shoulder at the very high end usually, right? Suprascap is going to be in the back part of your shoulder, right? Ulnar nerve is going to be kind of where your pinky, four index finger, your medial part of your arms, right? And then musculoskeletal like
Biceps, yeah.
yeah, biceps and brachioradialis and things like that, right?
Yeah, I guess I just didn't like get the full picture here. I guess looking back at it, limited movement in her right shoulder, fullness. I thought when they said fullness of the anterior shoulder region, I thought that was like telling you it's not axillary. Her right arm is held in slight abduction and
So it's kind of popped
externalization.
out externally, so you have a dislocation. It's
Oh, okay.
full because it's popped out of the socket going anterior. Does it make sense?
Okay, that makes sense. I usually miss those a lot. I don't do well with anterior shoulder though, because even though I know the mechanism, it's just like I just don't get the picture right when I do these questions. But okay.